Acute laryngitis emergency care and critical care. Acute laryngitis is a sudden inflammation of the larynx voice box, most often caused by a viral infection. It commonly affects children, especially those under 5 years old. The primary symptoms include hoarseness, cough, difficulty breathing, and even airway obstruction. In some cases, acute laryn. 1 Overview. Acute laryngitis is a sudden inflammation of the larynx voice box, most often caused by a viral infection. It commonly affects children, especially those under 5 years old. The primary symptoms include hoarseness, cough, difficulty breathing, and even airway obstruction. In some cases, acute laryngitis can become serious and life-threatening if not treated promptly. 2 Causes. Acute laryngitis is usually caused by viruses, particularly influenza, respiratory syncytial virus RSV, adenovirus, and rhinovirus. Other causes include bacteria Streptococcus pyogenes, Haemophilus influenza, allergies, allergic reactions to pollen, dust, food, etc. 2 Causes. Passive smoking. Cigarette smoke irritates the laryngeal lining, increasing the risk of infection. Environmental pollution. Air pollution can also contribute to acute laryngitis. 3 Symptoms. The symptoms of acute laryngitis usually appear abruptly and include hoarseness. This is the most common symptom, often appearing early and becoming more severe over time. Cough. The cough is usually dry and can become more intense at night. 3 Symptoms. Difficulty breathing. Difficulty breathing usually occurs when the inflammation spreads, causing airway obstruction. Vomiting. Children may vomit due to airway irritation. Fever. A low-grade fever often accompanies other symptoms. 3 Symptoms. Difficulty swallowing. Inflammation can spread to the esophagus, causing difficulty swallowing. Stridor. Stridor is a high-pitched whistling sound that occurs due to airway narrowing. Foul breath may result from infection in the nose and throat. 4 Diagnosis. A doctor will diagnose acute laryngitis based on the patient's clinical symptoms and medical history. Additional tests may be used to rule out other causes, such as blood test checks for inflammation and infection. Throat culture identifies the cause of infection. 4 Diagnosis. Laryngoscopy directly examines the larynx. X-ray examines the respiratory tract and identifies abnormalities. 5 Treatment. Treatment for acute laryngitis typically focuses on reducing symptoms and preventing complications. Treatment methods can include home care. Rest. Adequate rest helps the body recover quickly. Hydration. Fluids help thin mucus in the airways, making it easier to expel. Hot steam inhalation. Hot steam helps soothe the laryngeal lining and reduce inflammation. Home care using a humidifier. A humidifier helps maintain humidity in the air, reducing throat dryness. Over-the-counter pain relievers and fever reducers. Paracetamol, ibuprofen, etc. Saltwater gargles. Saltwater gargles can help cleanse the throat and reduce inflammation. Home care. Cough suppressants. Cough medicine can help reduce coughing and airway irritation. Avoid irritants. Avoid exposure to cigarette smoke, dust, and harmful chemicals. Hospital care. Antibiotics. Antibiotics are used when the cause is bacterial. Anti-inflammatories. Corticosteroid anti-inflammatories can reduce inflammation and swelling of the laryngeal lining. Bronchodilators. Bronchodilators help widen the airways and reduce breathing difficulties. Hospital care. Respiratory support. Oxygen therapy and mechanical ventilation may be necessary. Surgery. In severe cases, surgery may be performed to remove airway obstructions or widen the airways. 6 Complications. Acute laryngitis can lead to serious complications if not treated promptly, including airway obstruction. Inflammation can cause swelling of the laryngeal lining, leading to airway obstruction and difficulty breathing. Pneumonia. Infection can spread from the larynx to the lungs, causing pneumonia. 6 Complications. Otitis media. Infection can spread from the larynx to the middle ear, causing otitis media. Sinusitis. Infection can spread from the larynx to the sinuses, causing sinusitis. Meningitis. In rare cases, infection can spread to the brain, causing meningitis. 7. Prevention. To prevent acute laryngitis, you can take the following measures. Personal hygiene. Wash your hands frequently with soap and water, especially before eating and after using the toilet. Avoid contact with sick individuals. Avoid contact with people who have respiratory infections. 7. Prevention. Immunizations. Getting vaccinated against influenza, RSV, and other viruses can help reduce the risk of infection. Maintain a healthy diet. Eat a balanced diet and ensure adequate intake of vitamins and minerals to boost immunity. 7. Prevention. Exercise regularly. Regular physical activity can improve overall health and strengthen the immune system. 8 important points. If you or your child has acute laryngitis, see a doctor for prompt diagnosis and treatment. Do not take antibiotics without a doctor's prescription. Always follow your doctor's instructions regarding medication and treatment plan. If you experience any unusual symptoms, contact your doctor immediately. The upper respiratory tract includes nose, the first respiratory organ, responsible for filtering, warming, and humidifying inhaled air. Sinuses, air-filled cavities in the skull, which help create voice resonance and regulate temperature. Pharynx connects the nose and larynx, where the respiratory and digestive tracts intersect. The upper respiratory tract includes larynx, the organ of speech, responsible for producing sound. Common upper respiratory tract diseases: rhinitis, inflammation of the nasal lining, causing nasal congestion, runny nose, and nasal discharge. Sinusitis, inflammation of the sinus lining, causing facial pain, nasal congestion, and nasal discharge. Common upper respiratory tract diseases: pharyngitis, inflammation of the pharynx, causing sore throat, hoarseness, and difficulty swallowing. Laryngitis, inflammation of the larynx, causing hoarseness, cough, and difficulty breathing. Tonsillitis, inflammation of the tonsils, causing sore throat, fever, and difficulty swallowing. Common upper respiratory tract diseases: otitis media, inflammation of the middle ear, causing earache, ear fullness, and ear discharge. Note: the information provided in this article is for informational purposes only. You should consult a doctor for diagnosis and treatment.